Hello and welcome. You're watching a special broadcast from CNBC Africa, where today we are focusing on the global pandemic that has brought the global economy to its knees. So, quick check of the dashboard of where we are in terms of the number of infections in the world. We are sitting at 13.3 million. We are talking about 7.4 million recoveries, and sadly, 578,000 people have died to death. When we come here in South Africa, we know now we are sitting at 298,000 cases and over 4,000 people have lost their lives. So it's an important conversation to be having at this particular time. And in particular, it's important that we are able to get the views of the experts who are at the forefront of tackling this pandemic. So I am now joined by Professor Salim Abdool Karim, a clinical infectious disease epidemiologist who is, as I said, at the forefront of the fight against COVID-19 here in South Africa as the chair of Covid-19 Ministerial Advisory Committee for the country. Professor, thank you for joining us this morning. So those numbers are sobering and they are frightening at the same time. And one sometimes sort of gets the sense that we appear to be slowly losing this fight. Would that be an incorrect assumption?
Yes, good morning, Godfrey. I think, we always knew that this was going to be an uphill battle. From the time we had our first case in South Africa on the 5th of March, we anticipated that this epidemic will grow very rapidly. And indeed, for the first 3 weeks, it did. It was doubling every 2 days. But the measures that were taken with the state of disaster, closing the international travel, and so on, and with the lockdown, we slowed viral transmission down to a doubling time of around 15 days. But we always knew that as we eased restrictions, the epidemic would grow again. And true to form, when we eased restrictions on the 1st of June, by the 9th or 10th of June, pretty much every province started seeing an increase in cases. So this was expected. Can we really slow the spread of this disease? Yes, we can. The challenge is that we either slow it with using another lockdown, which at this stage is going to be too difficult and probably will not achieve its goal, or we achieve it through individuals taking ownership and instituting and being careful about the prevention practices, wearing a mask, ensuring you wash your hands, keep social distancing. I think if we follow those rules with a higher level of adherence, I think we could slow the rate at which this virus spreads.
Yeah, I want to come back and talk about the numbers, but I wanted to find out from you. So you say perhaps the better strategy is for us to take charge as individuals in terms of how we conduct ourselves so that we limit the spread of the disease. But when one contrasts that with the approach that the government appears to be taking, it appears to be more, you can do this, you can't do this, and then we are going to make sure you cannot do this, etc., etc. I am not hearing the persuasive message that says the responsibility to stop this starts with me, not with a policeman or a soldier telling me I can't do this or do that.
Yeah, I think that's been a continual challenge. To what extent do you depend on volunteerism, and to what extent do you depend on enforcement? And that becomes a real problem as to where you draw the line. At what point do you say that somebody is really not doing what they're supposed to be doing and you enforce the rules? And at what point do you make it purely, what do you do? I think at the heart of it is when one person chooses not to follow the rules, that person is putting themselves at risk. The problem is they're not only putting themselves at risk, they're putting their families at risk, they're putting their work colleagues at risk, they're putting the people they travel with at risk, they're putting their neighbors at risk, they're putting the whole community at risk. So there has to be some kind of balance between ensuring we have pure volunteerism and to what extent there's some enforcement. And it's always a challenge to find that middle ground.
Yeah.
I'm not sure we found it perfectly.
Yeah.
But one of the things that really is heartening is the way in which the government has now set up this new Ministerial Advisory Committee of community organizations, religious organizations, to help facilitate this change.
Yeah, I was going to compare our numbers with those of the UK, but I wanted to know first, when we go back to the beginning, the president said the response of the government was going to be driven by science. It was going to be driven by the numbers that we were seeing. And yet, we have now toughened the regulations at level 3. Some people are suggesting that we are back at level 5 just without the terminology of level 5 because in part, if you see what has been imposed, a large part of it was in level 5. I wanted to ask you, has there been a miscalculation on the part of the government in terms of how it has responded, number one, to the cases that are coming up, and secondly, in terms of the strategy that was adopted at the beginning?
I think when you look at the odd situation we are in right now, ideally, what we would have liked to have been in is a situation where, with the institution of very sharp prevention measures very early on, that we would have reached a stage where we could have contained this virus. Very few countries have been able to do that. Mostly they've been island nations like New Zealand and so on. But there are countries that have been able to do that. And I think we are in a position now to try and head in that direction. Even it's never too late to try. So what is it that we should be doing? We should be trying to balance what measures we put in place to slow the virus, at the same time putting in measures that enable people to protect their livelihoods and continue their jobs and so on. So that balance creates contradictions, and that's what we're seeing. But right now, government has taken 2 measures. The one is to try and slow the virus spread, which is through ensuring more enforcement and more rigorous effort to try and impose the prevention measures. And the second is to try and ease the burden on the healthcare system. It's so-called flattening the curve. Flattening the curve means cases are within the capability of the health system. So banning alcohol and curfews are really about easing the burden of trauma on the healthcare services. So healthcare services, transmission. Those are the 2 ways in which government is trying to impact this epidemic.
Yeah, I'm going to come back to that, Professor. I wanted to take you back to the original modeling. Was it wrong, or did we behave inappropriately to the extent that we busted, if you like, the original models and the numbers that it was projecting and the timings on when this would happen?
Yeah, I think models, are based on assumptions, and so they're always prone to change because we don't behave like maths. We as human beings, we change what we do. And so the models will not exactly predict what is going to happen. They just give you some indication. But overall, when we look at the adjusted models that have been continually fine-tuned to as new data becomes available, the estimates have been reasonably accurate. I think the estimate that we have to prove wrong is their estimate that we may see somewhere between 40 and 50,000 deaths. That, I think, is an estimate we can do a lot better on. And so far, it looks like we are able to have a lower case fatality rate. And that's because the healthcare system is better able to cope with the number of cases. When I say better able to cope, that's despite the huge pressures that they feel because of the large numbers of cases.
I want to compare our numbers with those in the UK. One, because the population sizes are almost the same. I think the last numbers I saw, 66 million in the UK, 60 million people here in South Africa, 59 point something according to Stats SA. Confirmed cases in the United Kingdom, 291,000. Confirmed cases in South Africa, 298. Deaths, we're talking 44 let's call it 45,000 in the UK. In South Africa, 4,000 plus something. I find those numbers fascinating in terms of how they differ, and yet we are talking almost the same population sample. What was the major difference between either our response here in South Africa or the response of the UK? Because we do know that South Africa has adopted some pretty drastic responses, and yet we appear to be matching number for number the increases in the new cases.
Well, it's fascinating that you chose to make that comparison, because at the early part of the South African epidemic, our trajectory was following the same trajectory as the UK. In other words, we would have had pretty much the same increase, rapid increase in the number of cases in all likelihood that was seen in the UK. So what's the difference? The difference is that we took early measures and they didn't. And so what happened was that the epidemic grew very rapidly in the UK. The health system was just overwhelmed because too many cases came all at once. And because they were not ready, they didn't have all of the wherewithal to provide the oxygen and the care that was needed. You know, they were seeing what we saw in New York and in Italy. You know, patients dying in the corridor trying to get a bed, just can't cope. And, you know, the system just get completely overwhelmed. And in our situation, a couple of things have happened. The first is we took those early measures, so we had time to prepare. So if you had to ask me in February, could you, redo a construction that would change the Cape Town ICC from a convention center into an 800-bed hospital in 7 weeks? I would have said, you got to be kidding.
Sure.
That's not doable, but they did it. And that's what the preparation was about. Now, luckily, we didn't need all of that capacity. And there are challenges in making that kind of capacity available all over the country. But that's the kind of thing that you need. You need to have those extra beds, and they need to come with oxygen, because that's really the problem. If you can provide oxygen to these patients, most of them will do well and they will survive. It's a very small percentage that need, heroic medication and ventilation and so on. So I think we had time to prepare, and so we are seeing a much lower case fatality rate.
Let's talk about the search for a vaccine or some kind of, medicine that's going to help us to cope or forget about COVID-19. I want to know South Africa's place in this, because we've seen various reports. Yes, we know Aspen has got a drug that helps people. We also know that Cipla, which is a company that operates from here, has also been roped in. I want to know overall, in terms of South Africa's response to this, what it is doing in the search for a vaccine.
Yeah, so South African researchers have been playing, an important role in various ways, whether it's in making new devices for airflow, for oxygenation or ventilation, or whether it's in sequencing the virus to look at, what's the stability of its genetic material and its spike protein, and so on. So we've been playing that kind of role. I think in the development of vaccines and treatment, we've played more of a secondary role. We're not developing any of our own vaccines, partly because we came into the epidemic at a much later point than others. And there are already about 160 odd candidate vaccines out there. But what we are doing is we are participating in international efforts. Right now, there's a vaccine that's been developed by Oxford University that we're participating in. There are vaccines that are being made by several other companies that will be tested here in South Africa as well. So we will contribute to the global effort to test a vaccine. We are contributing to the global effort to find new treatments. And I think that that's the role that we can play that would be constructive. I want to just add that humankind has never made a vaccine against a coronavirus before. Sure. This is the first time we're going to do that. So we don't even know if it's doable. I'm optimistic that it's doable because the genetic structure of the virus is very stable. But we have to see what these results will show before we can be confident.
Yeah. So one of the things that we keep hearing is that this pandemic has exposed governments' unpreparedness in tackling something on this scale. So I want to bring back the question to South Africa, and I suppose by extension to Africa. The work that you are talking about, is that government coordinated? Is there some kind of national coordination that says, here we are as a country, we're pulling our resources, our expertise into trying to make sure that we are able to make a difference in this? Or are we seeing our clever people sitting in their ivory towers here and there doing their own thing and then saying, guys, this is what we have found?
So I think it's a mixture of things. There are some things that are planned centrally, but I think much of the actual implementation is done at provincial level. That is the way in which our healthcare system is structured. Let me give you a simple example. One of the key things we need is oxygen supply. And so there were detailed plans that were drawn up that looked at what available oxygen there is and what will our needs be. And based on that, we estimated we would have a certain amount of a shortfall. Then we approached the 4 companies that make oxygen to find out what is the maximum they can manufacture. And then we found that even if they manufactured their maximum, we would still be short. Well, it turns out that about 80% of the oxygen that's made in this country actually goes to commercial purposes. Sure. And so we had to approach them and say, can we divert that for a period of 2 to 3 months? Some of that we need for medical purposes. And so that's the level of planning and so on that went into just trying to make sure we have enough oxygen. I have to say, no matter how much of planning you can do, in the 6 to 8 weeks you have, it's always going to be less than perfect. There will be hiccups. This epidemic just moves too fast for you to do very detailed planning so that everything's perfect.
Do we need a national structure, Professor Karim? And I'm asking this as a lay person, and I don't know at what level would need that kind of a national structure. Is it perhaps at the research level where there is coordination of the research that's taking place? I'm talking medical research, of course, around the country. Or is it better left to the universities to do what they can? Or do we leave this to the private sector to do this in their search for profit?
Yeah, I think as far as research is concerned, I think it's quite important that we already have a structure that is the custodian of medical research in South Africa, and that's the Medical Research Council. And certainly, the organization has deep roots in all of our universities and all of our medical research organizations. I was its president in the previous cycle. So if we need greater coordination, that can come through the existing structures. I don't think we need any new structures. It would just create a new level of bureaucracy. Right now, we need action. We don't need more meetings and more, talk shops. We need people to deliver on the ground, and that's where the challenges are.
Yeah. Let's go back to the models. What do they say now in terms of the overall numbers that we can anticipate? One, in terms of infections, and secondly, I don't know, we've got to talk about it, I suppose, in terms of people who may lose their lives.
Yeah, so, I'm not a mathematical modeler. I can only tell you about what other people's models tell me. And there is a national modeling consortium. Many of the country's leading mathematical modelers have come together and with support for the Department of Health to provide their best predictions. And, this virus behaves in ways we could not predict. I mean, when the minister asked me in March, what's going to happen, I said, well, this virus is going to really take off in Gauteng. I said, Gauteng is like our New York. It's got a lot of people, very dense, and you've got a lot of international travelers. And, it's going to grow here. I was wrong. I mean, it didn't grow. The epidemic in Gauteng really was so flat. And I can only assume that there was, a substantial effort on the ground at the Gauteng Health Department to go and do the contact tracing and to get people in. But the epidemic grew first in the Western Cape. I would not have guessed that. But that is the nature of this disease. We know so little. We learn as we go along. I call it, we're sort of sailing the ship as we're building it, because we don't know a lot of this, what's going on. So what do the models tell us right now? It suggests that we're probably going to see this high number of cases and even some increases in the number of cases, at least for the next sort of 6 to 8 weeks or so. Sure. And that's going to be driven by the different provinces coming into peak at different times. So we've already seen some of that occur in the Western Cape. It's not too early to say whether the peak's over, but it looks like there's some plateauing. Gauteng is still on the increase, and is going into that kind of plateauing period in the next few weeks. And then we'll see KwaZulu-Natal start taking off, and then that will be the main driver of the cases. So we're looking at really till about early September, where we'll see this kind of drastic situation. And then we'll start seeing the tailoring off. A lot of this is dependent on how much people are willing to change their behavior, because this virus can't move on its own. It depends on us. And we've seen this in the HIV epidemic. We have seen this in New York City, that when you get to a stage where large numbers of people know others, they know a family member, they know a neighbor, they know a famous person who's got this disease, who's died of this disease, it becomes personal. Absolutely. And they change their behavior. And it's sad that we have to wait for that, but that is what we will depend on to really lead to that change towards the end.
Yeah. And is it time, perhaps, Professor, for the message to become more about persuading people to change their behavior than it is about ordering us to do this and that? I'm telling you this from a personal experience, and also interacting with other members, people that I work with, people in my community, about how the government has gone about this. There's a resentment, a lot of it, about being told you cannot do this, you can do this, but we won't allow you to do this, etc., etc. And many people feel that the government messaging has been more about telling people what to do than it has been about persuading people that this is about your life, and if you do this, we will be able to beat this thing together. The president says it, the ministers come with their regulations and their domineering attitude.
Yeah, I think it's been a difficult mixed bag of trying to use persuasion and enforcement. And you're absolutely right. I think we need to have a much more concerted effort at persuasion. And there's a huge effort that's already underway to get people persuaded. Your challenge comes about is what happens when somebody is not persuaded and refuses to follow the rules. And I think that's something we're going to have to grapple with as a nation. But in many respects, it doesn't really help when we have rules that don't quite make sense or are difficult to implement, because then it's just hard to follow the rules. And we need rules that will be easy for us to follow, that make sense and that we can appreciate and implement.
Thank you very much. I want to put in one more quick question, and this is something that has troubled me right from the beginning about the government response. South Africa is a highly formalized economy, more informalized than any other economy in Africa. And yet, the government appears reluctant to allow companies to be at the forefront in terms of educating people how to respond to this virus. For instance, my thinking was at the beginning, instead of closing down the economy, perhaps close it down for a month like the government did, but after that, put the responsibility of ensuring that transmission does not happen at the workplace by putting this responsibility inside companies. And we know companies doing a good job. Everywhere you go now in this economy, you will be met with a sanitizer. There's someone who will say to you, where is your mask? And there's someone who will say to you, have you washed your hands? Why does the government appear reluctant to put this responsibility in the hands of companies that are in many cases actually responsible for the livelihoods of our people, apart from, of course, the government itself, the people that it employs?
Yeah, so you'll have to ask the government that question. I don't work for the government. But I can tell you that what is key is the current situation. So I'll give you an example. On Friday last week, I went to one of the shops to get a bit of fruit and so on for breakfast. I get there and I see the queue of people standing outside. It's a very, famous chain store, and they're not following the rules. They're not social distancing, and one person didn't have a mask. So I went up to the security guard who was spraying people's hands and so on when they got in, and I said to him, you have to make sure they're following the rules. And, he said, no, you can't do that. So I said, you understand that I'm putting myself at risk standing in this queue, and I'm putting myself at risk coming into this shop. So I'm telling you, I'm not doing my shopping here. I'm going to go and do my shopping at a shop that will actually follow the rules properly. Why should I put myself at risk in this way? And I think all of us have to do that. Because if we're willing to just fudge the rules and say, it doesn't matter that this shop is not following the rules and those people don't follow the rules, we have to protect ourselves, because by protecting ourselves, we're protecting everyone. And that's what I want to see much, much more.
More than it is about the government putting soldiers on police and telling us what to do. Thank you very much.
Exactly.
It's been a pleasure chatting to you, Professor Salim Abdool Karim, the chairperson of the COVID-19 Ministerial Advisory Committee here in South Africa. That's our program for today. Thank you for watching. We're back at 12 p.m. Central African time. Goodbye.